Hi everyone, welcome to the first edition of Talkie Talkie Doctor. Um, this is the first edition of it, powered by HCI HEALTHCARE Limited, your trusted HMO. My name is Dr. Kwe, and I'm your trusted head guide. We'll be talking to you today about sexually transmitted infection and diseases. These are conditions and infection that is not commonly talked about, and there are a lot of myths around it. So we'll dive into it on the things where you suppose know, the one where you not suppose know, the thing where you suppose they do, so that you will not catch this infection. So let's dive into it. So what are STIs? STIs are sexually transmitted infections. It means that these are infections that you only contract when you have sex with somebody that is already infected. So, what are the common STIs that we have around? Number one is HIV. Hepatitis is also another one. Gonorrhea, syphilis, herpes. These are common examples of STIs around us today. Okay, how people they take carry STI? So, as the name implies, sexually transmitted infection. It means say if you no knack person wey get am, you no fit get am. And it is contracted either through bodily fluid, blood, secretions, and all that. So for what are the common examples of these STIs? HIV is the number one. As you know, they will talk say HIV is no dey show for face. So you won't even know if somebody has it. And another example that is very common is hepatitis and syphilis, gonorrhea, herpes virus as well. So those are common examples of STI, and most of the time you contract it through bodily fluid, especially when you have sexual intercourse with somebody that is infected. Unfortunately, STI is on the rise, especially in Lagos, and that's because of the sexual culture, the sex culture that is already hookup culture, freedom of sex culture, and all that. So a lot of people are not taking what we call preventive measure, and that will take us to prevention of STIs. If you know you are going to have, let's say, you want to be having sex with everybody that you come along with, it is good if that is what you believe in, sexual liberation and all. But you should try as much as possible to protect yourself. Make sure that you use condoms, and also make sure that you go for a regular test every 3 months. And one important thing also is that if you have multiple partners, the problem with that is that you don't know who your multiple partner they knack behind. So why not just stick to one person and all? And that is the major way to prevent it. So how do you prevent STI majorly? Abstinence. You can decide not to have sex at all. That way you will not contract it. But if you know that you cannot do without sex, always make use of condoms when you are having sex, and also go for regular checkup, especially when you come in contact with somebody that is infected. So how do we manage STI? So there have several symptoms and signs that people always experience. It differs from females to males, and it is more common in females. That's because the urethra in females are very short, and the opening of the vagina is bigger than the opening of the penis. So for you to contract that infection is faster, and the symptoms are usually seen faster than in men. So if you have any symptoms like you're having secretion, fast smelling secretions, you're having itching around your perineal area, you should see your doctor. Don't just keep it at home. Don't just go and be using agbo, or you are scrubbing and say, oh, it's just itchy. You should go and visit your doctor. Let them examine you and let them run tests. And when they run tests and they've confirmed this thing, a lot of this infection can be cured, while some of the dangerous ones like HIV, hepatitis, and herpes, unfortunately, there is no cure for them, but they can be managed very well in such a way that you might not even be able to even transmit it to other people if it is managed very well. So what I will tell you today is that if you cannot practice abstinence, at least stay with one person and be faithful to that person. Use condom almost every time if you are not sure of the behavior or the chastity of your partner. And if you have any question, you can always reach out to us in our DM. Thank you very much and stay safe.